January and February are Equine Dental Month at McKinley and Peters Equine Hospital, and we want to just give you this little introductory video so that you can have some idea if your horses need their teeth floated or not. This is a little demonstration of how you can tell that yourself. We also want to just throw in the reminder that during January and February you can save 15% on all the dental work that's done on your horses, and for each horse that's done you get your name thrown in a drawing for a Samsung Galaxy tablet. So that's it. Hope you enjoy it. Hi, I'm Dr. McKinley. Today I'm going to try and help you learn how to know if your horse needs his teeth floated or not. And we want to start off by reviewing a little anatomy with our friend here. Teeth floating is basically taking the sharp edges off the outside edges of the upper teeth and the inside edges of the lower teeth and kind of balancing the occlusal surface here. The reason this needs to be done, if you look at this skull, the maxillary teeth or the upper teeth set wider than the lower teeth do. And the same is true if you just feel inside your mouth. Your upper teeth are wider than your lower teeth. And if you look critically, there's going to be, instead of having a very flat surface here, there's about a 15-degree angle between the upper and lower teeth. And so as this horse is eating over the years and weeks and days and months, the teeth grow in length, but the occlusal surface gets worn off. And what happens is these the outer edge of the upper teeth and the inner edge of the lower teeth flare out on the top and in toward the tongue on the bottom. And you can kind of appreciate these sharp points here on the outside. Pretty easy to feel. And what we're going to do is show you on a live horse how you can do that at home, just to check and see if your horse is getting these sharp enamel points so that you can know whether or not those teeth need to be floated or not. Now we're going to look at the live horse here. And what you need to try to do is think about the skull and the things that we talked about, the anatomy, and then just picture that skull inside of this flesh and bones here, the hair and the cheeks and the soft tissue and everything. And what we're going to do is simply run our hands along the outside edges of those upper teeth through the cheeks like this, and see if, while we're doing that, if we get any kind of a painful response. See how she's moving away from me right there? When she moves away from that, that's because there's probably a little sore on the inside of her mouth that we've got a point that's starting to stick in there into the side of her cheek. And so without sticking your hands in the mouth, without opening her mouth up, anything like that, you can very safely and effectively check to see if your horse needs its teeth floated. Now we're going to open this mare's mouth up and look at some of the things we're feeling from the outside on the inside of her mouth. She's been sedated now a little bit so that she'll tolerate this, and we're just going to open her mouth with this full mouth speculum. And I checked her before we started here, and she's got just a little abrasion on the inside of her mouth where one of the points is running in there, and we just want you to see that so you can kind of see what we're feeling from the outside. So now we're going to look at the inside of this mare's mouth. I got a little tool here, and see that little brown spot right there? That's one of those sores on the side of her mouth that corresponds to the point on the outside of this upper tooth that's digging in there. So that's what we're feeling for. We just go along the outside of those upper teeth through the skin, kind of demonstrate. Hopefully you can see this. See how I'm pushing with my finger, just pushing, feeling those outer points to see if she's sore in there, and you can see some mild pathology along her cheeks, and floating her teeth will help prevent that from happening, keep her cheeks in good shape, and keep her tongue from being traumatized as well. We went ahead and floated this mare's teeth, and one final point that I wanted to make that's really important. Enamel points and floating teeth is kind of just the tip of the iceberg in terms of things that can go wrong in a horse's mouth. And that was the case with this mare. She did have some enamel points, but as we got looking closer and doing a thorough oral exam, we found some big, long, huge ramps on her very back teeth on the bottom arcade. And this mare's had pretty regular dental work all her life, so she's been taken care of. And so the point is that enamel points aren't everything. We need to check the whole mouth and not only fix those enamel points and float them nice and smooth, but look after the rest of the teeth as well. Hope that's been helpful for you, and certainly if you have any questions, you can give us a call, 928-6734. Thanks.